For this week's Health Check, we're taking a look at part 2 about Pediatric Hospitalists, and I'm joined by WVU Medicine Camden Clark's Pediatric Hospitalist, Dr. Jordan Beckett, once again in studio to learn more about what Pediatric Hospitalists do and some advice for parents. Dr. Beckett, thank you so much for sitting down with me.
Thank you so much for having me.
Of course. So I do want to ask you, parents have the choice between a lot of different departments when it comes to bringing their child when they are sick. And I want to ask you, depending on what time of day it is, you have your normal pediatric rapid care, you also have the emergency department, and you can also just go see your pediatrician. Now, can you break down for us kind of the difference between these three things and what might be the best time of day to bring your child, depending on what sickness they have, to each of these departments?
It's a great question, and especially pertinent this time of year when a lot of kids are sick.
Absolutely.
Kids are sick a lot, upwards of 6 to 8, even 8 colds, a year, and each illness can last upwards of 2 weeks. So if it feels like your kids are always sick, they kind of are always sick. But kind of as a rule of thumb, I always encourage families to, if it's during working hours, call their general pediatrician. Their pediatrician knows their child best. They're the one who knows their medical history. They're the one who knows them whenever they're actually healthy. So, your child's pediatrician is that great place to, start. But for, whatever reason, if it's in the evening or your pediatrician's all booked up or the weekend, there are 2 other great options your child could potentially be seen. And number 1 is our pediatric rapid care, and number 2 is our emergency room here locally. So between those 2 entities, there is kind of a lot of overlap into what kind of care we can provide. Our pediatric rapid care is open 8 a.m. until 8 p.m. So if it's between those hours for a lot of things, your child can be seen there, whether it's colds or concern about ear infections or fever, rash, sprained ankles, things like that.
It varies.
It varies. There are a couple things that are kind of hard and fast. If your child has this, absolutely go immediately to an emergency room. That's number 1, fever in tiny babies. So if that's a fever in the first even two or so months of life, if your child has a fever, do not press go. Go immediately to an emergency department. If your child's in severe respiratory distress, whether that's from things like asthma or anaphylaxis, if your child has like an allergy, go to immediately an emergency room. If your child's having any mental health crises and you're worried about potential self-harm, you need to go to an emergency department. A couple other things in terms of trauma, if you're worried about a potential broken arm or leg that would need to be put back in place. We have to have that at our local emergency room.
Okay, and so I do want to ask too, as a pediatric hospitalist, if you were to be working with, someone in the emergency department or in the pediatric rapid care, if a child needs emergent care or has to be admitted to a hospital, what exactly is your role in that situation then?
Yes, so specifically at the rapid care, we are really trying to kind of streamline our admission. So, let's say your child is seen at our rapid care and we're concerned she, maybe has pneumonia. And we're thinking, I think your child needs to potentially come into the hospital, receive, IV antibiotics or potentially oxygen. We really try and have our physicians at rapid care call us as pediatric hospitalists, and we can kind of bypass our emergency room and kind of get you straight into the hospital that way. So that's one area within our emergency room. Let's say your child's being seen there, and our providers in our emergency room have some questions or concerns, and they're not sure is this child sick enough for them to be admitted, or is their child too sick? We need to send them potentially to a place that has a pediatric ICU. They can either pick up the phone and call us, have us come down into the emergency department, lay eyes, lay hands on the child, examine them. And so it's a really great teamwork between us as hospitalists, our staff in the emergency department, and our staff in the rapid care, really trying to kind of get kids to the place they need to be, whether that's home with their family, getting a lot better, or into the hospital as quick and as painless as possible.
Absolutely. And so I do want to ask too, what are maybe some additional benefits being treated by a pediatric hospitalist?
It's a great question. So those of us who are pediatric hospitalists, here locally and at most children's hospital, we are all board certified pediatricians. And what that means is that we have to always stay, current and updated on all of the, ever-changing things in medicine. So many things in medicine is changing even every day. Every day. And so with pediatrics, a lot of things are really protocolized based on what is that standard evidence-based medicine. So that, what that means is if your child has, say, asthma here in Parkersburg, you're going to be given the exact same treatment as if your child has an asthma flare in, Oregon or Massachusetts. So it's very streamlined. And those of us who are pediatric hospitalists are very aware and very experienced in managing those common protocols, and we are all very interconnected in making sure if there's a better way to manage things, whether it's like RSV or dehydration, we are all up to date on all of those ever-changing recommendations. So I would say that is the biggest thing, is that we have that experience, and we have that education background, that we are focused on just sick ill children in the hospital. So we are all up to date on all those essential protocols and standards of care here.
Absolutely. Well, Dr. Beckett, thank you so much for sitting down with me over the past couple weeks and sharing your wealth of knowledge on this topic. It's been truly a great time getting to pick your brain and share with the viewers a lot of this stuff, because I feel like this isn't the most common knowledge, so this is great to have, a breakdown for everyone to be able to learn about it.
Thank you.
Of course. When we return Mid-Ohio Valley, we'll have one last look at your forecast. Stay with us.